Greetings, this is Michael A. Weiss, and welcome to the Medical Minute. Today we are privileged to have on the telephone a pair of mental health providers, Steph Horgan and Tiffany Taft. Tiffany and Steph, can you tell us the exact name of your practice and where it's located so folks who live in the area could contact you?
Sure. The name of our practice is Oak Park Behavioral Medicine, and we are located in Oak Park, Illinois, which is the first suburb west of Chicago. And our phone number is 312-725-6175, or they can email us at info@opbmed.com.
We exchanged emails and you indicated that your practice treats primarily patients with chronic illness. Why did you guys make that choice?
I think the reason why we focused on that is because we've each been touched personally by that, and then we also see that there's just a big gap in services. There's not a lot of therapists that really specialize in this niche, and it's something that more and more people are struggling with and need some support on.
Do you guys mind getting into what it was or is in your personal life in terms of chronic illness or some type of interaction with disease or the healthcare system which made you want to dedicate your professional lives to helping people with chronic illness?
I feel comfortable disclosing that I have had Crohn's disease, which is a inflammatory bowel disease, and I've lived with it for the last 12 years. I've had 4 surgeries so far, and so just learning how to navigate the medical system and all the various stressors that go along with that is something that has definitely shaped how I am able to help our patients that come to us. My story is similar to Steph's in that we actually met through the Crohn's and Colitis Foundation of America at Camp Oasis, and so I also have been living with Crohn's disease since 2002, and I can say that being diagnosed with Crohn's really led me to go back and pursue graduate school and become a psychologist. Before that, I was actually working in a completely different field in the corporate world, and felt that I needed to find something that was a little bit more meaningful, considering the experiences that I had had. So it really brought me into focusing my attention on what it's like to live with the chronic condition and learning everything I could, both from a research perspective and from working with clients, so we can serve them better and really make sure that their lives are being lived as fully as they can be.
When you get a patient with Crohn's disease who comes in for counseling, do they relate stories where they've never trusted psychology because they really haven't found someone who really understands what they go through?
Yes, people have been referred to therapists, psychologists for anxiety or pain or concerns about their health. And there is this feeling of, what do you think, I'm nuts? Why are you sending me to a therapist? I have a real physical problem here. I'm sick.
Right.
And so what we work through is helping the person understand why they're coming in to see us, why they've been given this referral, normalizing that, look, we know you're ill, but we're here to help you in terms of adjusting and understanding what's going on.
How do you treat a patient who is not yet diagnosed with Crohn's disease or fibromyalgia or rheumatoid arthritis?
I think the first thing we do is just validate that their concerns are real, that we trust and believe that what they're experiencing is painful, is frustrating, and then also we just kind of give them an opportunity to really discuss and process all the frustrations, as well as kind of give them some tools to help with the stress of all of this. So even once you have the illness, you're going to be dealing with stress, but in the meantime, while you're trying to get the diagnosis and get a second opinion and get a referral and all those steps. We can kind of walk them through and just kind of give them stress management, relaxation strategies, and also just a platform to ask for advice on how to navigate this really complicated system.
When people come to visit you, the objective of the therapy is to get them as independent as possible so that they don't have to rely upon you. But you're always accessible when they have a problem or if they need to continue treatment. Would that be an accurate way to describe how you treat chronic patients?
Yes, definitely. We specialize in brief therapy, so using cognitive behavioral methods. Sometimes it can be anywhere from, like 3 to 6 sessions. And then sometimes there are ongoing issues where they need kind of a longer-term therapy. And it really depends on what the patient's needs are. If they're in crisis, if it's a brand-new diagnosis, that can be a lot bigger of an adjustment than just a change in the treatment plan. So we're pretty flexible.
Do you find that patients with different chronic illnesses nevertheless come to you with the same issues?
I think sometimes there are quite a few similarities across diagnoses. The biggest one is just adjusting to a new normal and having to adjust to having those ups and downs, those times of flares and remissions, and learning to accept that as this is the rest of my life. It's not an acute thing, but it's something that's going to be chronic.